the least effective method, of course, are the natural methods, the withdrawal method, because even with the withdrawal method, still,
You have to do it right.
you have to do it right, to be honest.
Hello everyone, welcome to my YouTube channel. My name is Tolu Akinyemi. It's a privilege to be in your space again today. If you're a new subscriber, you're welcome. Please don't forget to hit the subscribe button if you're new here. And if you're a returning subscriber, thank you so much for being here. Thank you for watching. Your views make a lot. It has a lot of impact and I'm grateful. Today, we are going to be talking about a very important topic, and I have a special guest here with me. Her name is Dr. Chidiogo. She is a general practitioner, and she's here to address a particular issue called contraceptives. She's a general practitioner. She loves to bake, and she's made a business out of teaching people who are beginners in baking how to bake. I'm going to put her details, her YouTube channel, in the comment section. She's amazing, and I have her here. Honestly, we're going to be talking about contraception. Why are we talking about contraception? Why are we talking about contraceptives? It's because having children have a lot of impact on our lives. Sometimes you plan to have a baby, you feel you're ready. Other times you're not ready. It just feels like the baby just came out. Hello, surprise! It's amazing, you know. Babies are beautiful. They are gifts from God. Sometimes you just need to be ready financially, ready spiritually, ready mentally, be in a phase of life where you feel that I can accommodate having a little one around me. And I can say that parenting is one of the toughest jobs ever. It's even beyond just bringing a baby to life. It's about raising them to be responsible people, you know, raising them to be whole. You just see a little person going around reacting to things and situations the way you do. So you see yourself in that little child moving around. So we're talking about contraceptives today. And thank you, Dr. Chidiogo, for coming.
Thank you very
today.
much.
It's nice to have you here.
Thank you. Thank you so much for having me. Yeah.
So we're talking about contraceptives. What are contraceptives? What is contraception?
Contraception, so it's any method or process people use to avoid getting pregnant when they have sexual intercourse.
Okay, thank you. Any process that you use to avoid getting pregnant at any point in time. Okay, that's very nice. Let's talk about the types.
Okay.
The types that we have that are available to people. Because I asked people on my status, I said, if you had the opportunity to ask a doctor about contraceptives, what would your question be? And they decided that, oh, the side effects. Someone said, the side effects. That's exactly what I want to know. The side effects. You know, some people feel, oh, this person used it, they just blew up, became very big. This person used it, they were just bleeding for a very long time. You know, there are different things, different tales that you hear here and there. So let's talk from a doctor's perspective.
So I know that, you know, this is a topic that people really have many questions about.
Yeah.
You know, they're confused, which type do I use and all that. And the thing is, we're going to address the different things that you need to consider before you choose your contraception. But I would like to say that it's important that when doing so, you know, seek advice from your medical professional, you know, because there's different conditions that one may have that will determine whether it, you know, one type of contraception is good for you to have.
Yeah.
So in terms of the different types that are available, so I think the most common one, people will know that there are barrier methods, which is like the male condom. There is also female condoms. There are other barrier methods are less common, like the caps, the diaphragms. I think that may be probably less common because those ones might need a professional to actually help you fit them in. But apart from the barrier methods, then you have the hormonal methods, which I think that's where, you know, all this anxiety is coming from.
That's true.
So hormonal methods involve the pills. And in the pills, you have the two pills. So there's one that is the combined pill, it has two hormones in it, and then there's the mini pill, which has one hormone in it. And then apart from the pills, you also have there are rings. So they're actually hormones. Many people don't know about them, but they are still types of contraception. So there's the vaginal ring, and they also have the combined patch. So we don't really talk much about. Well, I mean, these are available, so it depends on where you are in the world. You know what's available to you. And then you have the longer acting reversible contraception. So, before going to that, still part of the hormonal contraception, you have the injectables as well. So the 3 monthly injections that contains the progesterone injection. So so you have that. And then you have the long-acting reversible contraception, which is what we know as the coils, and the implant. So implant is a small device. You do a small operation that puts it under the skin, and that can last like 3 years. And you have the coils, 2 coils. You have one that has hormone in it, and then the other one, non-hormonal coil, which is the copper coil. And there are other methods that like sterilization. So that's a permanent. So where a woman goes and they tie her tubes. Or you have the male version of sterilization, which is vasectomy. And then you have the natural methods as well. So which are less reliable, but then they can be an option for people. So the withdrawal method or the fertility awareness method. And then you also have the lactational method as well, where if a woman gave birth, has delivered and is breastfeeding, within the 6 months, as long as they are exclusively breastfeeding and they've not seen their period yet, that is actually a form of contraception.
Is it effective?
It is effective, actually, funnily. But of course, nothing is 100%. All these methods, there's no one that's 100% effective. But the lactational period is actually very, very, if it's up to 99% effective, as long as, as long as the woman is, exclusively breastfeeding, has not seen the period, and what was the third thing? Exclusive breastfeeding has not seen the period
within 6 months,
and it's within 6 months. Yeah.
Okay, that's very interesting to know. And you've talked about different types: the coils, the injections. How effective are these methods? Like, if I decide I want to try one of these, what is the rate? How effective is it?
Okay, so there are some of these methods that depend on the person, so that they call them user-dependent methods. And of course, anything that depends on you knowing how to do it, or depending on you in any way, they are less effective. But things like, using the condoms, it depends on the person, and also things like it could split, it could burst, it could slip, the different things. So the least effective method, of course, are the natural methods, the withdrawal method, because even with the withdrawal method, still,
you have to do it right.
You have to do it right, to be honest. And fertility awareness methods, where people use apps to track their methods. It also depends, is your cycle regular? Because if you're not having a cycle that is regular, you won't be able to calculate it properly.
I think it will be difficult to know your ovulation,
exactly,
if your cycle is very
irregular and all that. So in terms of figures, so we know that if 100 women are depending on the natural methods, so fertility method or the withdrawal, up to 25 of them will actually get pregnant. 25
is a good figure, except you're part of the 25.
Exactly. So 1 in 4, can you imagine? So it's not very effective. But the good thing is, if the other methods are not suitable for whatever reason, it's always good to combine methods. So if you say you want to rely on withdrawal, make sure that you're not withdrawing on the day you're not safe. So combine the different, so make sure so that you actually have that combined effect. But even then, it is still not effective. That's why we need to know about these other methods. So the other methods, the condoms, 18% failure rate with typical use of condom. Still high. 18 people out of 100 is still high with typical use. With the pill, with typical use, when we say typical use, so with the pill, there are 9% failure rate. So typical use is, as we are humans, sometimes you may forget, with perfect use, pill is actually quite effective. It's like 99% effective if you're using the pill with perfect use, which
But
means
humans are not perfect.
exactly,
Anyway, you forget
which means you're not
sometimes.
forgetting, you're taking it at the right time and all that. You do not vomit afterwards, you do not have diarrhea, but with typical use, 9% will be pregnant. That's 9 out of 100. The more effective ones, though, so the coils, like I said, the implants. So the coils, the two type of coil, the copper coil failure rate 0.5%.
Okay.
That's like 5 in 1,000. So that's quite effective. Then the hormonal one, the Mirena coil, 0.2. That's even more effective.
Yeah.
And then the implants, that's 0.05. So that is
it's very
the highest it can go.
Because it doesn't depend on you.
It does not depend on you using.
Yeah.
Once you've put the coil, that's it. You go about your business. You're not trying anything. Once you've put the implant, is there. It's just releasing the hormones, and it does not depend on you. So.
All right, thank you, doctor. Excuse me. We talked about the different types. How does it work? If you use coils, how does it work? Just help us.
Okay. So of course, in terms of the barrier methods, that one is obvious.
Yes,
it's barrier. So there's actually a natural barrier that prevents the semen from getting in contact, with the woman's reproductive system. So basically, the sperm doesn't get there. In terms of the hormonal ones, so the pills, and also major way they work is that they actually suppress ovulation, so that the woman doesn't actually get to release the eggs that will then get fertilized.
Okay.
But there is another way they can also work in terms of thickening the mucus at the cervix. So cervix is the neck of the womb. So they actually thicken it. So it's like there's a plug there, so that the sperm can't actually have access, because there is actually a very thickened plug. And that's even the way that the Mirena coil, that's the major way that that one works. Another way that they work is that they thin the lining of the womb, so that nothing can even implant, nothing. So those are the 3 different ways that these hormonal contraceptives work, and that's why they're very effective, because they're coming from 3 different angles.
Yes.
You're not ovulating. Like, even if you try to ovulate, the sperm will not even, and even if then there's no, the wall is thin, and there's nothing that can even implant. So those are the ways that they work. In terms of the copper coil, it's not a hormone, but the copper itself is toxic for the womb, for the lining of the womb.
Okay.
So it's toxic. So that copper will make the lining of the womb, nothing can implant there, and it's also toxic to the sperm as well. So that's how that one works.
Okay. So what are some of the things that you need to consider? Are there things about your lifestyle? Are there things that you need to consider before choosing any of these types?
Yes. So the different types will not be suitable for everybody.
Yeah.
So it depends on many things. One, it depends on your physical health. So, for example, the combined pill is the one that has the more restrictions, because people that have, say, uncontrolled high blood pressure cannot take the combined pill. People that have migraine with aura cannot take the combined pill. And then also the progesterone pill, if you have some types of cancers, you can't take it. So that's why it's very important that you need to seek your doctor's help. Smokers, people that are smoking and are obese as well, combined pill is not safe for you, because it has a risk of developing clots, in the legs or lungs.
Okay.
So anything that already increases your risk of developing clots, like smoking, being very obese, things like that, just puts you at even higher risk of that. So combined pill is not safe, but the mini pill is okay for those people. So mini pill is generally safe for majority of people. If you have migraine, if you have blood pressure, if you're a smoker, you can use the mini pill. But even the mini pill still has its own. So just make sure that you're seeking your medical advice.
That's very important. Seek medical advice. For someone who has like irregular periods, do you think such a person should even consider using contraceptions?
So it depends on if you have irregular period and you don't want to get pregnant immediately, because it could be that the person wants to get pregnant, and then of course, but if you have irregular periods, you are still able to get pregnant. So you can't say that because you have irregular periods you're safe, because until you're 55, even with women that are older, you are still, even if you have irregular periods, so until you're 55 years or you've reached menopause. Menopause is, so if you have not seen your period at all for 1 full year, and that's after 51. So say you've got 50 and then you've not seen your period for 1 year, then we consider you that you have reached menopause. But if you have not gotten to that level, maybe you're still seeing your period irregularly, then
you're still
ovulating and you can get pregnant. So contraception is absolutely necessary.
Okay. Do contraceptives, do they affect your mood? Do they have any impact on your mental health?
Yes, so some of the hormonal ones, like, I think that's where people are like, they have the questions, skeptical about that. So the thing is, different people react to, your body reacts differently. These are drugs. It's just like someone will react differently to paracetamol. Someone may have a rash with paracetamol, and another person doesn't have a rash with it. So we know that, mood swings can be one of the side effects for these hormonal pills, whether it is the combined pill or the mini pill. But then the combined pill is actually one of the treatments for things like premenstrual syndrome. So some women find that, in their natural cycle, when they are getting closer to their cycle, they start having symptoms, physical symptoms or even mental symptoms, where they are moody, they're irritable, they're anxious. Some will even start having physical symptoms like diarrhea, bloating.
That's true.
Just before their period comes, and once their period comes, everything goes. So that's what we call premenstrual syndrome, and that's just because of the fluctuations in the hormones of the woman during that time. They actually use combined pill to treat that, because the combined pill has two hormones. It kind of gives your body a stable level of hormone during that time. So that is actually used to treat it. But then some people that don't have premenstrual syndrome find that when they take the pill, they have mood swings. So it's just so eventually it's still a factor of trying different types, because there are different types of pills, different combinations. So if one doesn't work for, as long as you've checked the safety in terms of your health, like you don't have all these high blood pressure, migraine, all those, and they say, okay, this one is okay for you to use, then try it first. And if you have intolerable side effects, then stop it and try another type.
So you would advise trying different methods before you settle for which one you want to use. Another thing is, like I said earlier, people were asking, what are the side effects? I know people will say, oh, I used this and then I became very fat, or my sister became very fat, or after she used this, she was bleeding off. Can you touch on those kind of things? I'm sure you'd have heard those kind of things.
So there are common side effects with the pills. Both the combined pill and the mini pill. The combined pill has less of them, but then they have, the breast tenderness, the unscheduled bleeding, that's like bleeding in between your periods. In terms of weight gain, there's actually no evidence that these pills or even the coils cause weight gain. The one that has evidence is the injection.
Okay.
So the injections, that people take every 3 months. Yeah. That one is known. Some people have weight. No, it's not like, so for all these things, it's not everybody that will get the same thing. But that one has been found that weight gain is one of the side effects for that. But every other one, there is no evidence that they cause the weight gain. There are many other things that can cause weight gain in women, especially like, most of these women, maybe they just gave birth, and even just the fact that you just gave birth is enough
for you
to gain weight. So it's not even that so there's so many other things, there are stresses. So if you know that weight gain is an issue for you, there are so many things. Exercise, it's not just looking at the contraception as the thing that caused it. As things that you can do to reduce your risk of adding weight. So other things like acne as well. So acne is, the pimples or skin rashes that people can get on the pill or the mini pill. And in terms of the bleeding, so the bleeding is not the same for everybody. So when people initially start the pill, a lot of people might have unscheduled bleeding because your body is trying to get used to it. But most times, within 3 months, you should get to a normal cycle. So people using the mini pill, okay. So people using the mini pill, majority of them will not even have periods, or they will have light periods.
That's my question. If you don't have if your period is not flowing, is that going to be a problem? No problem.
No, it's not as if the period
for 4 months, 5 months
is there. It's internally. You're not bleeding internally, or it's being stored up in your womb or anything like that. No, there's no problem.
All right,
it's safe. It's safe to not have periods. Yeah, so that's why even for people that usually suffer with heavy periods and painful periods, the combined pill is actually quite good for them because it helps to actually lessen their periods and the pain and all that. And also the hormonal, so the Mirena coil, the same thing. Most people on the Mirena coil will not even have periods, or those that have periods will have very light periods. The opposite is for the copper coil. So the copper coil is known to actually cause heavy or painful periods. So yeah.
So I think that's it. It's safe to say that the kind of contraceptive to use is, or maybe this is like an individual journey.
Exactly.
Because at the end of the day, our bodies are
It's not what happened to your sister that will happen to you.
Exactly. I remember when I was pregnant, some would say, my tummy is very small. I had a very big so my tummy is very small, but mine was very big.
Exactly.
And our bodies are different. So my sister did not even get fat. This one did not even have stretch marks. This one, we are different and our bodies will react to things differently. So it's safe to say that this is a personal journey for you as a person, and it's good to seek medical advice on things like this. There are so many options available, and you also said it's safe to try different ones with the advice before you settle for a particular one. So what do you want to leave the audience with today? What are some touch points that you want to mention?
So like we said, this topic is important because bringing children to the world, as much as children are lovable and is a gift to have children, but if there is a way to actually plan when to have children, that is something that all women should be embracing, so that you know that you are at your best, financially, mentally, physically, because some people are advised not to have children because of their physical conditions. Maybe they're taking tablets that can actually affect the development of the baby. So it's important that you look into all this so that you're at your best bringing children into the world. And to be able to do that, you need to factor in all these things: your lifestyle, your physical health, your mental health. Seek medical opinion, and don't be scared about side effects that other people have had. Your own body is different from theirs. So just look at all the the advantages and disadvantages, whether you need it for the long term, whether you need it, for the short term, and decide on the contraception. And if one doesn't work for you, try the other one.
Wow, thank you so much. One thing you said that sort of made me remember something. At some point, I lived with a family that had a school for special needs children, and one of the things I was told then was a lot of women, maybe you're on a particular medication at some point, and then you conceive, or you were pregnant, early pregnancy, and you use the medication, affected the development of the child, and then you now give birth to a child with special needs, and these things happen, but we just need to take precaution. Thank you so much for coming on the show today, Dr.
Thank you very much.
It's been nice having a conversation. Hopefully, this is not the last time. We are still coming back. We have more and more topics to discuss. Thank you so much. Thank you for staying till the end. It's a pleasure to be here. Please don't forget to hit the subscribe button. Till I see you next time, or till we see you next time. Bye for now.
Bye-bye.
Bye.